Good afternoon, everyone. Happy Wednesday. Hope you all had a restful and relaxing festive period and end of year break. At ACCHS, we are slowly getting back into full capacity with many of our teams still on break. So we're really excited to start the new year with the Corporate Services Lunch and Learns with you all and trial these in the webinar formats, which is not what we've done for the past few ones. So I hope it all plays out well today, but otherwise it's a real good learning for us to get feedbacks from you all. So before we commence, I'd like to acknowledge the traditional owners in the land which we're all meeting from today. And for those of us based at ACCHS, I acknowledge the Whadjuk people of the Noongar Nation and pay my respects to elders past, present, and emerging. For our session today, I'm delighted to introduce you to Josie Fullerton, who is the project lead for the Modified Service Delivery team at Patricia Giles Centre for Non-Violence. With a background in disability sector and NDIS, Josie delivers training and resources to help services respond safely and effectively to people with disability experiencing family domestic violence. She's also joined by Jess O'Sullivan, who is the project officer for the Modified Service Delivery project at the Patricia Giles Centre, drawing on her experience in child protection and the disability sector. She will be co-facilitating the training and provides resources that support services to respond to people with disability impacted by family and domestic violence in a safe and inclusive and appropriate way. So today's session, as you would have probably read on the registration page, we'll go over the MSD pilot, which is the Modified Service Delivery pilot delivered by the Patricia Giles Centre for Non-Violence, strengthening the connection between family and domestic violence and disability services by building the skills of workers across both sectors. The presentation will share information and strategies to help management and colleagues recognize and respond effectively to situations related to family and domestic violence in the workplace. I would also like to mention that Nicole Cunningham, who is the Family, Domestic and Sexual Violence Program Coordinator at ACCHS from our SEWB team, will also be tuning in to today's sessions to answer any specific questions that may arise. So Nicole will be able to support with those. And with that, I will pass it on to Josie and the team, but also letting everyone know that these sessions are recorded and will be available on the ACCHS member services portal for you or your teams to access later down the track. Take it away, Josie.
Thanks, Joelle. Hi, everyone. So my name's Josie. I'm in the pink shirt and Jess is here in the black shirt, just so you can know who is who. I'm just going to pop a presentation up on the screen and hopefully you'll all be able to see that in a moment. There we go. Can I maybe just have like a thumbs up or something so that we can see that presentation? Yep. Perfect. All right. Thank you so much. So as Joelle already explained, we are here to talk to you a little bit about the Modified Service Delivery Pilot Project, but also some information that might be helpful for you in your roles. Before we get started, I did just want to as well acknowledge that Jess and I come to you from Whadjuk Noongar Boodja land and acknowledge the traditional custodians of this land, but also extend that to the traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and community. Would also like to pay my respects to them and their cultures and to elders past and present. Now, because we are speaking about family and domestic violence, we also do an acknowledgement of courage, and we acknowledge the courage and dignity of those who stand up and say no to violence or who take action to hold perpetrators accountable as well. Lastly, in terms of acknowledgements, we have quite a number of people with disability who shared their stories with us to shape this project, and we also acknowledge the courage and generosity of them to share their knowledge but also their experiences with us to help us shape what the project is today.
Okay, just a little bit around looking after ourselves. We are discussing abuse, neglect and violence experienced by women and children with disabilities. So if at any point throughout our presentation today you're upset by the content, take a break if you need to. Otherwise, there is support available. As you can see on the screen, you can contact 1800 RESPECT. They can offer that confidential support, or alternatively reach out to your employee assistance program, who can also provide the same support. If you're unsure who that is, reach out to one of your managers to find out. So a bit about the project. Josie and I, as you know, work for the Patricia Giles Centre for Non-Violence, which has been around for over 30 years now, supporting WA families affected by family and domestic violence. We offer residential support for people experiencing FDV, and this is through our 3 refuges, which are located in the northern corridor of Perth. We also offer counselling services for both women and children, and we also have an outreach service which supports people that want to remain in their homes. Then we have the Modified Service Delivery Pilot Project, or as we like to call it, the MSD project, and that's the project Josie and I work within. So essentially some background on that. The Patricia Giles Centre received funding from the Department of Communities, and that was to bridge the gap between disability and family and domestic violence services to better support women and children with intellectual or cognitive disabilities experiencing family and domestic violence. Now, we do this in a range of ways, as you can see on the screen. We have developed several resources and fact sheets for workers within both sectors. We also deliver sector-specific training workshops. So we do one that's more tailored towards the FDV workers, and then we have another one for the disability workers. We also provide opportunity for that cross-sector collaboration and networking, and we do this through our cross-sector meetings, which we host once a month. Most of them are online, but we do try throw in a few face-to-face ones throughout the year. This is really a great opportunity for workers within both the FDV and disability sector to come together. We provide updates on our services, any new programs that might be out there that we need to know about, but we can also have a discussion around any complex cases and try and come up with solutions together. We also have guest speakers that will come along to usually introduce their service or a new program that they're offering. We also have provided co-design opportunities for people with disability, as Josie touched on before. That was earlier in the project. We formed a co-design group of people with disability or parents of children with disability that had experience of FDV, and they created some fantastic co-design resources to really help other people with their experiences. And then we have our information, advice and mentoring component of the project. That's more around allowing people within both sectors to reach out to us if they need some support around where to go when they have clients that perhaps have a disability and an experience of family and domestic violence.
So we just wanted to share some information with you. These are some of the slides that we do through our workshop, but we've kind of picked out the ones that would be most applicable for you. So firstly, the project and really all the work that we do does have a focus on women being the victim survivors of family and domestic violence, and that's because we know that here in Australia women are disproportionately impacted. On the screen you can see that 2 in 5 women have experienced violence since the age of 15. Women are also most likely to experience violence by someone they know rather than a stranger. And around 95% of all victims of violence, whether they be women, men or gender diverse people, experience violence by a male perpetrator. It used to be said that on average 1 woman is killed every 9 days by a current or former partner, but we know that that has increased over the last 12 months. And in Australia, intimate partner violence contributes to more death, disability and illness in women aged 25 to 44 than any other preventable risk factor. We also know that in the year 2021 to 2022, the last time this information was captured, that there was 4,620 women aged 15 years and over that were hospitalised due to family and domestic violence, which is an average of 13 women a day. Family and domestic violence is also the leading cause of homelessness for women and children in Australia, and in that peak COVID year of 2020 to 2021, there are 116,200 people using homelessness services that had experienced family and domestic violence. Lastly, we also know that children are disproportionately impacted, with 2 in 5 children having an experience of exposure to family and domestic violence. I think these stats really just highlight the impact that family and domestic violence has here in Australia, and the likelihood that you may have a colleague within the ACCHS environment, within the ACCHS workplace, is quite highly likely as well. So what we wanted to quickly share with you is some of the types of violence, because we know that for many people and many victim survivors, they may not classify what they're experiencing as one of violence because it may not be physical, but we also know that there is many other forms of violence. So these 10 categories that you can see on the screen were developed by 1-800-RESPECT, and we're going to talk about them in a little bit, but in consultation with people with disability, because it was really clear that people with disability struggle to identify their own experience of violence, and kind of making it in an easy to understand format is helpful for anyone that's experiencing trauma, not just people with disability. So those 10 categories are on the screen, and we have developed a little resource document that will be shared with you, and in that we have a link to these 10 categories, which is called Types of Violence Resource, and they have the definitions as well as some examples of what that looks like as well. Within your roles and the work that you do, it's quite likely that you might respond to a disclosure, and we thought that this information might be helpful for you if a staff member was to come to you and tell you that they are experiencing violence. This information came from a previous training package that Pat Giles used to produce called FDV First Aid. So we thought that this was really, applicable to what you do at ACCHS. So we know that it can take courage and strength for a person to disclose their experience of domestic, family or sexual violence, and the way in which the way in which you respond to that disclosure has a significant impact on that person engaging in services and seeking safety in the future. So it's really important that we do respond in a way that is sensitive and compassionate to the person. So these are 6 key principles to follow when responding to a disclosure. The first one is to believe what the person is telling you. So, using that reaffirming language, I believe you. The opposite of that is acting in shock and saying things like, I can't believe that would ever happen to you. I had no idea this was going on. Just really using that affirming language and saying, I believe you, I'm here for you, and really doing that active listening, which kind of brings us on to the next point, to listen and let the person do the talking, and really listening without judgment. So kind of, again, not that shock, and just allowing them to do the talking, and they may not be ready to tell you everything all at once as well. So just allowing them that space to have that conversation with you. The next one is around confidentiality. So we want to acknowledge the person has the right to privacy, but also within your roles, it may not be appropriate for you to keep that disclosure a secret. You might need to go to management or someone else to make sure that you are following the right policies and procedures, but as well, if that person is in significant risk of danger or harm, you may need to contact the police or things like that as well. So the best way we've heard this done is saying, you can trust me, and I'm only going to tell people that need to know for your safety and for your safety here at work as well. The next one is providing information and not advice. This came through quite clearly from our co-design group. They said, I had thought of every reason to leave. I had thought around, what services I could access, and people telling me that information that I already knew wasn't helpful. So what they said is, give me information about the services, but don't tell me what to do. So saying things like, did you know that there's a women's domestic violence helpline that we can call? Did you know that you're eligible to access FDV leave? Those kind of questions, and then seeing what they have already thought about and what the barriers might be to accessing those things for them, and how you might help them with that as well. The second last one is to build trust with the person. So not everyone is ready to talk about everything all at once. So it might be that this is the first time they've disclosed to someone. So it might be talking to them about who else they might have spoken to, or who else they might trust with that information. But as well, it's also that keeping in touch piece. So maybe setting up that they come and have a chat with you in a week to see if anything has changed, or if they are wanting to make any changes, or if they're wanting to stay in the situation as well, just working out what the best things you can do to support them through whatever choices they make as well. We then just wanted to quickly touch on some of the 24-hour helplines, just because this is kind of that first point of call if you are going to, if someone is needing assistance with their experience of family and domestic violence. So you do have the Women's Domestic Violence Helpline, which is for women with and without children that might be needing support. It's really important to note that these phone lines are there to support the person on the phone end to end, so they don't get any follow-up time. So it is quite likely that you will be put on hold and waiting to speak to a worker for a little bit. So if the person is in crisis and needing immediate support, we would recommend that you call the police in those instances. But this is to be assessed and see what supports and what referrals might be needing to make for the person. The Men's Domestic Violence Helpline is there to support men who have an experience of family and domestic violence, but also might be concerned about their own violent or abusive behaviours. So if you were to have a staff member that is exhibiting those abusive behaviours, or you've overheard a conversation, it might be recommending that they contact this number for their own support as well. And lastly, we have crisis care, and that line is managed. That line manages the Women's Domestic Violence Helpline in those after hours, but they are more looking to support someone that is in crisis or concerned of a welfare for a child as well. So the crisis could be that they're experiencing homelessness, or they're experiencing family and domestic violence, and if there's children involved and you're concerned about them as well. The other helpline that we wanted to quickly touch on is 1-800-RESPECT. So they are the National Domestic, Family and Sexual Violence Counselling Information and Support Service. That is a mouthful. So they provide counselling on the phone, as well as that referral option as well. So not only do they have the phone line, they now have a text line, they have an online chat function on their website, and they also have that you can now book in like a Zoom or Teams call with a therapist, with a counsellor, so that you can see them as you speak to them. It's not only for victim survivors of family, domestic or sexual violence, it is for their friends, their family members. You could be a work colleague, you could be anyone in their life supporting them, and you're actually able to call as well. We are going to quickly play you a short video that just explains this in a little bit more detail, and then we'll move on to some other information for you. Perfect. So there's lots of information on the 1-800-RESPECT website about safety planning and information within the workplace and things like that as well. So we'd really recommend you having a look on that website. We know that it's really important as well that in the moment when you are responding to someone experiencing violence, to be able to know where to find services for them, in that little resource pack that we have sent through, you'll have information about how to find the services within your area. We've given you 2 service directory options. One is from the Centre for Women's Safety and Wellbeing. Not only do they have family and domestic violence services on there, but they also have community health, legal supports, child services, youth services, and men's behaviour change programs, and men's services on there as well. Additionally, they have sexual assault services and children's sexual assault services as well. So it's a very extensive list of services that they have on there. The great thing about that service directory is you can filter it by region. So if it is someone that is, say, in the Midwest, you're able to filter it by that, and then also select what type of service you're after. So if you're after outreach programs, if you're after counselling, you can filter by those options, and it will come up with the service and then what their contact details are and how referral can be made into that as well. The other directory on there is called Your Toolkit. This website is fantastic. It has a great amount of resources for safety planning for the person experiencing violence, but there's also a page on there about within the workplace, FDV leave and things like that as well. So a great kind of one-stop shop for FDV resources. They're also WA based, so very handy to have on hand. So that is how you can find the service that you might be recommending that your colleague attends, or sharing these for them to search for their own in their own time and things like that as well.
Okay, so as I briefly mentioned before, we do run our own training workshops. So as you can see on the screen, we've got some QR codes. If you were ever interested in attending one of our workshops, you can scan the QR code for the centralised sessions. They're the ones that are specific to either the disability sector or FDV workers. But alternatively, if you do have multiple staff interested in a particular workshop, we do also deliver them internally at your organisation, and we can tailor these workshops to suit your needs. So if that's the case and you're interested in that, please contact us to discuss this option, or as I said, scan that QR code and fill in the details, and we'll be in touch.
And they're generally 3 hours and they're free. There's no cost associated, and we bring all our resources and things like that as well.
So as part of the project, as I mentioned earlier as well, we have developed a number of resources. Now, whilst these are for the disability and the FDV sector, the content within them is quite universal and may assist you within the workplace. Resources are available via the Centre for Women's Safety and Wellbeing website, which is the peak body for FDV services. So on here, you can find our co-design resources that I mentioned earlier that were specifically developed by people with disability for people with disability. Topics covered within these co-design resources are topics such as you have rights, information for family and friends, and learn from our experience. You'll also find a range of additional resources that we have developed, and this includes information on types of violence, signs of violence, and responding to violence.
And I think this is the, second last one. So I mentioned before that Your Toolkit have a great service directory. We also just wanted to share kind of the information that they have on their website around working and experiencing family and domestic violence. So Your Toolkit provides a free step-by-step guide on personal safety, as well as support services, also financial support that the person might need if they're experiencing family and domestic violence. On the website, they do have the section called Working and Domestic Violence, and this has information about understanding your rights at work, support that you can get from your workplace, how to find new employment, but also managing work whilst experiencing domestic violence as well. So a really great resource to have on hand. And like I mentioned, that kind of Word document, we've got all the links to these as well. Now, this is the last one. We wanted to just chat to you about a new course that has come out. It is e-learning module. It can be done online. It's called Foundations of FDV. It's been produced by DART, who are one of the leading FDV training organisations here in WA. They've collaborated with a company called Learning for You. This can be downloaded as a SCORM package, or also you can just complete it on their website as well. So this course provides an overview of family and domestic violence and the impact that it has on the workplace. In there, you can learn around topics like recognising if someone you work with might be experiencing family and domestic violence, as well as the legal obligations around family and domestic violence leave entitlements here in Australia. So the course topics you can see on the screen, there's a bit of an introduction and then understanding FDV. They then speak about FDV in the workplace and what the person's rights are. Same with the FDV leave. And then they also have some information around providing empathy and support, more so in those manager or kind of colleague to colleague roles. And then a bit of a conclusion at the end. They say that this course only takes about 20 minutes. It does have some really handy videos and then resources that you can click in and save as well. So we thought that that one might be helpful to you within your roles at your workplace as well. Now, we were given half an hour and we're at 12:29, so and then a couple of extra minutes for any questions that you all might have. So I think we will open it up to the floor now and see if anyone had any questions for us about either the project or any supports that you might need within your roles as well. So if anyone has any questions, I think there's a bit of a Q&A function that you can ask those or pop it in the chat as well. I've just stopped sharing my screen so we're able to see everything a little bit more, but Kimberly, I can see you've got your hand up.
Hi, Josie. Thank you. This is more, I suppose, a question for maybe some of the attendees online. I'm mindful that we've got, a couple of different member services represented here today, and I'm just wondering if anyone has any experience that they'd be happy or willing to share with us about how they may have managed some situations or disclosure of FDV in the workplace. Perhaps some practical things that other services can be implementing to be supporting employees, even behind the scenes, just the sort of day-to-day things that others might not have thought of if they haven't experienced it. If anyone has got anything that they wanted to share. Nicole?
Oh my God, that was so techo. How did I do it? I just basically wanted to share that some of the teams within the network, in the member services, do FDV trained teams. So within those services, which is only 6 out of the 23, if there was any of the team members experiencing FDV, I'd hope that they'll be able to go and chat to those services, it's those people who work in that program. And I suppose, reaching out to EAP is probably one of the biggest things that can be helpful in this scenario. So, yeah. And I've got a question after everyone's finished. Well, after the next, yeah.
I think I can see Tina's hand, and I think the difficulty in the microphones is probably a system parameter I put in, but I'm letting them have access to the microphones. Tina, are you able to unmute yourself? You should be able to.
Hello, can you hear me?
Yeah.
Yeah.
Oh, yep. Okay, cool. I had a bit of experience with a staff member just before Christmas that experienced FTV, and basically they just want to be heard as well and supported. So I did sit down with the staff member and had an extensive chat with her, I think it's, can't say good, but I should say that if you've experienced it yourself as a person, that helps a little bit, because you have been through that or you've seen that as well. And I'm talking about myself as well, through family upbringing and also seeing my sisters experiencing it as well. And so I think it's a little bit genuine and raw, because you're able to, because you've had that experience, you sort of know how to answer that as well, because you've had that experience. But definitely they just want someone to sit down and listen with them. When I did have that discussion with the team member as well, that they also think that EAP isn't worth it, because it's not a face-to-face person. They feel like they're talking to someone on the phone. They're not sure if that person has had the experience as well, and they don't know that person. Absolutely. And then the other thing is, myself, and you can't see me, I'm an Aboriginal person as well. It also depends on their ethnicity as well. So speaking to an Aboriginal person, that staff member felt a lot more comfortable as well. So that's just a little bit. It's not everything, but that's a starting point for them.
Absolutely. Thank you for sharing, Tina. And I know that in the services we did list on that resource, we did put some Aboriginal specific ones, because we know that for some Aboriginal and Torres Strait Islander people, they would feel much more comfortable sharing it with someone that they feel can relate to maybe their situation or that cultural background as well. So, and like you mentioned, it is, sometimes they just want to share that information to get it out. We don't need to be solution focused in that moment. It can be really tricky as maybe someone that does want to fix it for them, that having that boundary up and just being able to listen and, you know, be a person that they feel comfortable sharing it with is half the journey in itself. So thank you so much for sharing that.
Sorry, I also just wanted to add one more on there, is from, you know, the experience of domestic violence, it's all about blame as well. So I also ensured that it was a no blame game at all.
Yeah.
Not even mentioning that at all as well, because they probably, number one, hear it from their partner. They probably hear it from their family, depending on how long they've experienced it for. Then I just ensured that I focused on that person. You need to remember that this is about yourself, your positive aspirations going forward. What are you going to do? And don't ever blame yourself. I didn't say that, but I always don't say anything about the blame, because they've heard enough of that from peers, family, etc.
Absolutely. Yeah. Thank you so much, Tina. Nicole, I can see you've got your hand up as well.
Hi, back again. Just wanted to confirm that was exactly what Tina said. Everything is correct there, because like EAP, and as Kimberly's written, EAP is not for everyone, and especially if you are working remote and regional. So and that lived experience is so valuable as well. So the only other thing I was going to ask was, do you guys offer any training to the disability sector outside of Metro in relation to this?
Yeah. We do. So our training package is run WA wide. At the moment, if organisations would like us that are outside of the Metro area, we're kind of taking expressions of interest to try and, I guess, make a case to be able to go out face to face and deliver the training. But we've had a significant increase in regional and remote services joining our online sessions. I think about 30% of attendees over the last 12 months have been from a regional and remote area. So it's definitely, we've seen that increase in interest from those areas as well.
Yep. Thank you.
No worries.
I think that's all the questions for now. Otherwise, we'll take some on records and can surely reach out. But as mentioned at the start, these sessions are on the ACCHS members portals. So if you would like to share this with any of your team members, feel free to do so. And I believe Josie's project has the scope to support member services directly, as we had them come and present at ACCHS to our staff. So feel free to make use of those opportunities as well. So really thanking Josie and Jess for your time and coming on board for our inaugural Lunch and Learn session for 2026. And I'm sure you will be working closely with many of our member services over the course of this new year. Thank you.
Thank you so much for having us, and thank you everyone. We're really pleased and happy to help wherever we can, so please reach out if you need anything or any of your member services as well. So thanks so much.
Thank you.
Thank you very much.
Before we let everyone go, I've got a few matters to share with everyone. First is to introduce you to Liam Guy, who is our Senior Public Health Program Officer at ACCHS, to inform you about the digital health survey that ACCHS is implementing. So an email was sent out to you all as part of the Workforce Network this morning, but Liam will share some more details, and we'll close off the meeting with giving you some information about the upcoming session in March. So you should be able to come on board, Liam. I'll put you in spotlight.
Perfect. Thanks for that, Joel. And hi, everyone. Lovely to meet you. Just as Joel mentioned, really, at ACCHS, we're currently facilitating an online digital health self-assessment survey. So basically, we're just wanting to see how the services and your staff are utilising Australian Digital Health Agency resources. And it's an opportunity for you to suggest what digital health and cybersecurity training and resources you're interested in receiving. So you can complete the survey by going back to Joel's email. There's a link or a QR code. I've just put the link in the chat as well. So feel free to complete the survey. It only takes a couple of minutes. And we'd really appreciate if you can share this survey throughout your service as well. It can be for any staff member. We're not looking for anyone in particular. The more responses, the better, really, and help us to collaborate with ADHA in, basically creating better resources.
Thank you, Liam. I think that pretty much concludes our session for today. And as you all know, we host the Lunch and Learn sessions on a bi-monthly basis on the second Wednesday. So our next session will be on the 11th of March, and we will be having the Australian Digital Health Agency come and present a streamlined session on their Cyber Champions program. So predominantly around cybersecurity awareness, 3-point validity, phishing checks, and professional emails and organizational emails. So there is scope for us to add topics that might be relevant and important to you all. So feel free to reach out to us, and if there's anything specific you would like to be incorporated into the session. Otherwise, thank you for joining our first session for 2026, and I hope to see you all at other events and sessions that ACCHS hosts. Thank you.